Hello and welcome again to Your Health in Your Hands, where we try our possible best to give you the most relevant, the most important information for you as a Nigerian, you as a Black person. And by the way, I want to say a big thank you to you all for having been for your patronage over the years and for your loyal attendance and all the feedback you've been giving us and our team, to me and my team. We've been very, very grateful. And by the way, a few months ago, December 9th, to be exact, 2023, because of your faithful attendance, we actually won the award. I personally, but it's a group thing. We won the award for the most respected CEO in Nigeria in the healthcare and hospitals category. Tremendous honor. I thank you so much. And I thank the award giving body for this. They had to go through millions and millions of applications or millions of nominations. And quite frankly, I don't know how it ended up with us, especially since I'm not even in the country at this time. So even my team had to go and receive the award on my behalf. Luckily, I was able to see the video. So thankfully for that. But it's all because what we're trying to do is, again, to serve you in a way that is relevant. We don't want to just give you any kind of information. And usually most information that comes from medical textbooks or medical information is from the Western world, which in many cases may not specifically, I'm not saying in all cases, but in many cases, it may not specifically apply to our situation in Nigeria. So it's important that we do this, and it's important that we have the support of people like Dr. Ichegu, who was with us last week, and he's back again with us today. Thank you, sir. Welcome.
Thank you so much again, Dr. Jibade, for what you do and really emphasizing prevention. As I said, the award is befitting for you, and I'm glad that people are out and watchful of people like you who are doing what they can to make a big dent in the areas of things that impact our people. You know, you look at brain issue. You take a family, you have somebody who is a breadwinner in that family, and all of a sudden the brain goes, and the whole family is into chaos. Okay, now when you are doing things to prevent such things from happening, that is no amount of thank you, no amount of payment is even there, because that breadwinner for that family is all it in that family.
Yes.
So again,
yes.
Please continue what you're doing and preaching to people, and again, highlighting prevention and the medical conditions that can, make those conditions bad if we don't manage them. And yeah, I'm glad to be here. Thank you.
Well, we really appreciate it, sir. All right, let's get into it, because off camera, you are making some very, very serious statements, and this should scare every Nigerian. And one of them was this: people can have normal blood pressure and still have heart attacks and strokes and kidney disease and so on. Can you explain that?
Sure. Let's take a person that have high blood pressure to begin with. Okay. One of the things about high blood pressure when it happens is that it is what we call a silent killer. So your pressure may be very high and you're not going to feel anything. So when you're waiting to get a headache or something, by that time it may be too late, maybe with a stroke and stuff like that. Now, high blood pressure as is, first attacks the small vessels that goes to the what we call end organs. Such organs like the heart or the kidney or the brain or the eyes. And even, remember, even a blood vessel have a blood vessel that feeds a blood vessel. So when you look at very tiny blood vessels, when the pressure is high, those blood vessels are really in jeopardy. That's what we call pathophysiological mechanism, which we're not going to go into here, but just understand that those tiny blood vessels feeding those organs are in jeopardy. So let's say take for the heart now, as that pressure is high and the little blood vessels are affected and the heart muscle begin to get weak. When the heart muscle gets weak and it cannot pump as much, the blood pressure may become normal because it's not pumping as such. But even though it has become normal, that patient is still at the risk of heart attack. Because in the beginning, when the heart is facing high pressure, the muscle of the heart becomes thicker because it's like somebody who is lifting weight. As the muscle gets thicker and thicker, then it gets even harder for the tiny blood vessels to feed blood vessels through, through those thick muscles. And then the muscle can get weak in terms of pumping. Okay. And when that is the case, then you may even find that the blood pressure will become normal and even may become low, making it even difficult to manage those situations, but they are still making the heart, not being able to function well. And you can also have a heart attack on top of that, irrespective of other risks, such as smoking, a high cholesterol, or even, of course, genetic issue, or even stress. You can actually have a heart attack just with stress alone, even when other things are normal. So there are many things that can lead to a heart attack, even when you have normal blood pressure, yes.
Oh, that is scary. I mean, in many of my speeches, especially to the groups in Nigeria, you would have someone who would come up and say, well, I know when my blood pressure is high because I can feel a headache, but I know when my pressure is normal because I don't feel anything. So I know when to take my medication. Can you explain the folly of that reasoning?
Yes. So that's, again, that underscores the importance of educating patients about blood pressure issue. Blood pressure is what we call a physiologic thing, which means I can think hard in front of you now and my blood pressure will go up, and I can settle and the blood pressure will go down. Now, I can be faced with something and my blood pressure will go up for a protracted time, and then I calm down when it goes down. But remember, each of those times when that blood pressure is high, those little blood vessels feeding those organs are affected. So the very fact that your pressure came down when you relax a little bit doesn't mean that that you don't have high blood pressure anymore. So when you are placed on a blood pressure medication, you have to continue those medicines to keep that pressure normal. So that when you're under those stressful situations, or even when you're thinking about those things, the pressure doesn't go that high by affecting those organs. So that is important to take your medicines and monitor your blood pressure morning and evening. It may sound like a lot of work to do, but you check your blood pressure morning and evening, and if it is being controlled on the medicines, you continue that medication. If it's not being controlled, you talk to your doctor to either change or increase or make sure that you're on the appropriate medications. Because one of the things, hopefully, we're going to get into it, is how you can best manage blood pressure, because it's not just a number issue. You have to protect those organs. Yeah, so that's important.
Yeah, so you bring up a very important point, and I think we should get into it. But we also need to talk about drugs to protect the end organs as well. But before then, we want to talk about Nigerians on many blood pressure medications, because sometimes people make the mistake that this is a better drug because it is the latest and the greatest from the US. And then they just willy-nilly prescribe this for Nigerians, not realizing that our biochemistry and our physiology is different. You just spoke about physiology, and that there are specific drugs that work best for Africans or Black people that may be harmful. I actually met someone on a wheelchair yesterday who died from being prescribed, I believe it was lisinopril, as an ACE inhibitor, right?
Right.
He actually said he died, and they had to resuscitate him. And that's a drug that works very well for white people, but can be very harmful to Black people. So can we do I know we don't have all that time, but do an overview about educating people about this?
Yeah, that's a very excellent observation. I'm glad that you actually brought that up. So I'm going to take a little bit of time to explain that particular issue. Okay.
No problem.
As we did indicate that high blood pressure attacks those organs, and when it affects those organs, they fail. Okay. There is what we call the RAS system, and this is where I indicate the role of the physician and healthcare providers in appropriate management of high blood pressure. High blood pressure is a physiologic problem. So where you have a number issue, the number is high, but then you also have an injury that happens to the little organs. So in managing hypertension, it is important to protect those little organs, which are key organs of the body, and then also use medication that lower the blood pressure as well. So you're going to end up needing a couple of medications to do that. Okay. So the idea of thinking that you're going to manage your blood pressure with just one number, with one medication, is not correct. You know, you may have a combination of medication in one, but in general, you're going to require more. And if you're looking at the type of blood pressure that Black people tend to run, where blood pressure is in the 170s, 180s, 200, invariably you're going to need multiple medicines. Okay. So back to the RAS system, which we call the renin aldosterone angiotensin system. That system in the body, which we all learn about in medical school, is the driver for high blood pressure. And that system in the body operates in almost every place where you have a blood vessel in the body.
Mm.
And that system is responsible for the end organ damage that happens in those little organs. So it becomes important to block that system. You know, so when you see a patient who have high blood pressure, you have to look for reasons to put them on medication that block that system, you know, where it blocks them so that the organs are protected. Just take a look at, like, you have an important document in your home and you put it in a safe that is metal. If the house burns down, if you open that metal, you still have your document. But if you did not, if you just leave it in the house and the house burns down or water comes, it will destroy that. So medications, what we call like ARBs, blocks the receptor for those RAS system, you know, so they don't damage the organ. ACE inhibitors does the same, but in a different way. Now, the problem is that ACE inhibitors were more in the market before and much cheaper and had more research done with them. So people tend to use them more, like lisinopril. But the African-American patient, the Black patients, tend to react to lisinopril and ACE inhibitors as you go up on the dose. And so when they react to that medicine, they are labeled as being allergic to that medicine. And once they're allergic to that medicine, then you find that nobody will give them other medications, such as the ARB, that does the same thing and even do it greatly. And so when you stop giving them that medicine, then their organs are left to destroy. So that's why you find that hypertension is the #1 cause for heart failure, #1 cause for stroke, and #1 cause for kidney failure in the Black patient.
Wow.
Okay. And as you know, heart disease is the #1 cause of death globally, and also the #1 cause of death among African Americans here in the country. So blocking that system is very important. But when you're going to block it, you have to use a medication that they're not going to have allergy to for the African American. You know, so ARBs tend to be what we tend to use for the African American patients, as opposed to the ACE inhibitors, because once they get allergy to ACE inhibitor, then you can't give them those medicines. And when they go into heart failure, you can't even give them the medication for heart failure, which also have ARB inside it. So really starting early to block that and finding a reason to start them on that medication that block those conditions becomes very important in managing hypertension in the African American patient. Yes.
What does ARB stand for again?
It's angiotensin receptor blocker.
Okay.
Yeah.
All right.
And that, yes.
But what seems to be and correct me if I'm wrong, but it seems to be the most popular and the most effective drug for Black people, the one that doctors just prescribe at a spinal level, is of course the calcium channel blocker, amlodipine, which seems to be very, very successful for Blacks. What are your thoughts? It doesn't seem to me like you're too thrilled with that particular kind of drug.
Yeah. So as I indicated, for the African American patient, the type of, and Black patients, again, you know, when I say African American, I'm talking about Black patients in general. Medications such as calcium channel blockers and also diuretics, they can bring the number down. They can do that much more better than the ARBs would do. There's no question about that. So if I give you an ARB as an African American, it's not going to bring your blood pressure down as well as calcium blockers would do. Okay. But if you understand how to manage blood pressure in the African American patient, you must protect their organs. And so you use an ARB to protect their organs first. It's not really the main thing for you to lower their blood pressure. And then add the other medicines such as the calcium channel, there's a calcium channel blocker and diuretics to bring the number down. Because if you're not protecting their organs, you're not really helping them. Now, you're gonna find out that many a time a patient goes to a doctor and they find out they have blood pressure issue. And the first thing they give them as an African American is a diuretic. Okay. Now, when you give somebody a diuretic, what you end actually doing is you increase the activities of the RAS system. So you actually, aggravate the chance of end organ damage.
Wow.
Because again, when you give them diuretic, you are trying to get away the salt that's really driving their blood pressure. There's nothing wrong with that. But the issue is protect their organs while you do that. Because if you just give them the diuretic alone, your organs are being destroyed when you don't even know that. And all of a sudden you say that, hell, you have kidney failure, your heart failure, this, So you have to understand what you're doing in managing these conditions. And that's again why we partner with doctors in the other underserved areas with remote monitoring to help them manage this condition, because some of these nuances, they are not familiar with it. And this is what we do on a daily basis. So we can help them manage those. Yes.
I hope you are, through this your system and network, you're creating these videos and teaching these doctors about these things and our healthcare professionals and all that, because what you're talking about is very important, and I don't think it's widely known.
Indeed, it is known but not known, because again, remember, there are industries on these medicine issues. There are researches, that are there before other medications. But then as you manage this patient population, you begin to have more experience in that group of patients and what really works out for them and the true pathophysiology as to why that is.
Yes. Oh, okay. So it seems to me that what you're saying is we have to use combination drugs, focus on the primary problem, the blood pressure, but also focus on protecting the end organs. And I know you've explained this already, but if you catch hypertension early and this is just theoretical, I'm hypothetical now, you're giving them, person just develops hypertension, maybe they're in their 40s, 50s, whatever, and you start giving them the calcium channel blocker or the diuretic, what is the risk of them having any organ failure or end organ affectation, damage, if you treat the blood pressure ASAP, as soon as possible, as soon as it develops? I mean, how would the end organ damage have happened if you treat them right away?
Right. So it is important to understand that high blood pressure is like a consuming fire. Okay. Rises, it goes down, it rises and goes down. And let's say if you have a wood, when it's completely burned and become like ash, there's no fire. And when the fire is burning very heavily, you may not even see a smoke. Blood pressure, when the number is high, is a smoke. Just because you don't see the smoke doesn't mean there's no fire. So when the fire is really burning, it is very good. You may not even see any smoke. And when it completely burns out, there's just ash. So when you understand that pathophysiology on a patient, no matter when you see them, it is important to screen for end organ damage immediately. So checking for things like urine for protein immediately once they come in. Checking for like EKG or echocardiogram, looking to see if there's already an effect on the wall of the heart. Or checking the eyes to see if there's any issue already, or seeking to see if they have sleep apnea, because their pressure is just going to continue to go, and then they begin to forget things, and they begin to get erectile dysfunction. So you look for reasons that will make you understand they're already at risk of end organ issue already, and then you put them on these medications early, not waiting till everybody now knows they have organ dysfunction. Now, let's say now when your heart fails, there's a medication that we call Entresto. Entresto is a combination of an ARB and another medication together. I'm not going to be going to this in detail because of the lay audience, together to help modulate the heart and help the heart function. So that's why we don't wait till when you really get to that condition to start the ARB. So if you're already sure that you're losing some protein in the urine, we start that early. If you're already showing an LVH and all that situation, we try to begin to, know there's already an organ issue. Begin to do combination medication. Of course, if there's a reason why you may not be able to do that, that exists, but understand that you really need to protect those organs. Yes.
Interesting. All right. So, question: amlodipine is considered cheap, and that's why people prescribe it willy-nilly. ARB, in my opinion, I don't know what the cost is, but I don't think it's going to be cheap. What do you have an idea of or what the cost is and how readily affordable this is for Nigerians?
Yeah, so that's a good observation, and you find that people will gravitate to things like ACE inhibitor because they are cheaper, they've been around and all that. But let's say if we understand ARB is available now anyway, but at least it's still a little bit more expensive than some other medications. But if we understand the cost of care when a person have a stroke or when they have heart failure or kidney failure requiring dialysis, no amount of money you're paying to prevent that by starting the proper medicine on time can be compared. And no amount of money you pay like for remote monitoring to manage those patients can be compared. And then no amount of life can you save can be compared. So you find that invariably treating a condition properly is much better than waiting for the complications to come and then you say now you can manage it. You send a patient, let's say from Nigeria, to come here to get heart transplant. It's not gonna happen because they can't afford that. But if you can give them, make it available to protect their organs way early, you're not gonna have any of them flying over here to try anything like that. But anyway, so it will be more cost effective in the long run and better management of patients using the proper medications early. Yes.
That's a good point. That's a very good point. There's no way, as the saying goes, a pound of an ounce of prevention is worth a pound or kilo or ton of cure.
Yeah.
But we can't afford it these days. I heard this really bad statistic. One of our guests said that African Americans are 13% of the US population, and yet when it comes to dialysis and kidney failure, we represent over 35% of those who are actually going for dialysis and chronic kidney disease and treatment and all that.
Yes, you are absolutely right about that, because again, there is this understanding of not giving the African American patients an ARB or ACE inhibitor early, waiting till they get problem first before you give it to them. And then the next thing is, when you give it to them, you give them ACE inhibitor first and let them fail the ACE inhibitor before you can give them an ARB. And then when they get allergic to an ACE inhibitor, then you put a label that they're allergic, and nobody in their right mind want to switch to another medication unless the type of allergy is like cough or something. If it's anything serious, they're not gonna give them an ARB. And so when they get into heart failure, they're not getting any of the medicines that are gonna help them. When they get into kidney dysfunction, they're not gonna get any of it because nobody is willing to give it to them. And so you're gonna have that high level of people needing dialysis. And of course, again, the type of blood pressure the African-American patients suffer from is way, 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 way higher. So you really need to have a combination and a lot of education. And, let me even take this moment to really talk about the patient's role in managing blood pressure. See, the patient must be a compliant patient.
Yes.
You have to have your own, willingness to be alive and understand the complications for high blood pressure and work with your doctor. If the doctor says check your blood pressure morning and evening before you take your medication and you're not checking it, they're not gonna know. If you're ready before you get to the doctor, you say, I'm not gonna take any medication, they're not gonna help you. When you come in and they explain to you that you need medication to protect your organs and you say, no, I don't want any medication, I wanna do it on my own, try to control my family stress and all that, they're not gonna help you because you're gonna get organ dysfunction. Or if they say to you, you have to change your lifestyle, you have to exercise some more, you have to lose weight, you have to do sleep study, and you don't want to do any of that, okay? Or they say no alcohol, or that let's say now, listen, your social environment is a problem, think about how you can reduce your stress situation and how to really, join a church group, go to church, spirituality and all that to help you because it really helps. And you don't want to do any of that. Yeah, you're going to run into issues. So there are roles that the patient have to play to help manage the blood pressure and reduce those complications. Yes.
Absolutely. Well said, Doc. I just want to say again, thank you for what you're doing. You could just stay where you are and enjoy the cushy life of being a cardiologist in the US, which obviously is very cushy. I can see that's probably behind you, I think, is one of your vacation sites, right? Where you usually frequent, eh? Is always at Maui or
Well,
Grenada, or wherever.
so let me tell you, I love my background when I'm, on this because it takes away the stress. So when I'm looking at those breeze, it's just beautiful for me. So it's a way of really, keeping the stress level for me. So, but when I
I
go
love
on
it.
vacation, I like to go on vacation in places like that and just enjoy those weather. Yes.
Absolutely. But I thank you for thinking, still taking such a great work and still thinking about your motherland, your fatherland, and helping the people there. And I hope that whatever you're doing will continue to expand. Of course, Abuja, and of course to the other parts of the north and other parts of the country. And I believe that the word will spread and spread and spread rapidly. So we thank you again for all you're doing, sir.
Thank you so much for all you're doing again, and thank you so much for having us. Okay, God is with you. Thank you.
Thank you, sir. God
Yeah.
bless. And folks, again, thank you so much for joining us. This has been very important. You can go to our website. You will see archives, brainandbodyfoundation.org. You will see archives of these videos. And you need to take these videos and show them to your healthcare professionals, to your families, because this is very important information. This is not commonly seen. In fact, I'm ashamed to say this, but I heard this mainly from Dr. Ezekwu. I have not heard this from other doctors who even treat cardiovascular disease and all that. So it's very important that you take, not just bring the numbers down when it comes to hypertension, but you also take drugs that protect the end organs, especially the brain and the heart, and of course, the kidneys. Doc, final before we leave.
Again, as I said last time, prevention, prevention, prevention. Why is prevention very important? Well, one, it's affordable by everybody. It is cheaper. It gives you a better quality of life. It also prolongs your life, and you enjoy your family even more and saves you money down the line. So you can really live longer and enjoy full life. So please work with your doctor. Don't wait till you get symptoms before you start checking, which is one of the problems we have sometimes. People wait till they're about to drop dead before they go see a doctor.
Yeah.
Implement prevention. I ask the Nigerian government to please understand the concept of prevention so you can allow clinics to open up for prevention. A clinic should be a clinic, not a hospital. The goal is to prevent people from going to hospital. Have people understand the concept of going to clinic where they get things checked on a monthly or every 3 months or whatever to prevent conditions from getting worse. Not that they have to go to hospital. One of the problems in Nigeria is that every facility has to be a hospital. So patients always think about hospital. Oh, I don't want to go to hospital until I'm having, something have happened. So you have to change that mental state, where they can understand, oh, there's a clinic, which is not a hospital, where I go for preventive care. Okay. Not just a government established health center or something, but other doctors to have clinics to manage these conditions. And then if you are really that sick, then you go to the hospital. And then from that hospital, you can go to a tertiary hospital. So people have to have that ability to do that. And don't force doctors to always establish a hospital setting. You have not addressed the people's mentality in prevention if you are doing it that way. Yes.
That's a really, really good point. Outpatient. I don't even think there's any such thing as an outpatient clinic in Nigeria. There's always hospitals.
Always hospital. That's always the thought process. Yes. Yeah.
Yeah. Well said, Doc. Thank you so much again. And we shall definitely be having you back on for more talks like this. God bless you, sir. Take care.
Bless you too. Thank you. God bless you and your audience.
Bye.
Yes.